You're tuned in to Women in America, the podcast that dives deep into the issues shaping gender equality in the US and beyond. Hosted by Pari and Eve, public health professionals by day and content creators by passion, we bring you expert insights and actionable strategies to push the fight for equality forward in today's America. On this episode, Congresswoman Mary Gay Scanlon joins us to explain how the government shutdown isn't just tied to the healthcare of those on the ACA, but the healthcare of all Americans. Let's dive in. I have today with us Congresswoman Scanlon, and she is coming to us straight from her district office, which is a nice treat because normally when I speak with congressional folks, they're in DC. Congresswoman, how are you doing? What's the vibe like right now?
It's pretty much chaos all the time. It's really hard to plan when you don't know where you're going to be and trying to communicate as much with people so they understand what's going on and what we need to do to get out of it.
Absolutely. What's it been like communicating with your Republican colleagues at this time? Are you still going back and forth to DC? Are the Republicans actually showing up? What's the situation?
Sure. I've been going to DC for a couple days each week. The caucus has been meeting regularly, so it's an opportunity to catch up with my Democratic colleagues, but the Republicans have not been showing up. In fact, some of my colleagues may have gone on Republican hunts around the Capitol and filmed some of them, filmed themselves looking for Republicans and coming up empty. I mean, it has been frustrating, but it's not just since the shutdown. It's really been what we've seen for the last 2.5 years while Republicans have had control of the House. They have repeatedly refused to come to the table to negotiate with Democrats, which, would produce something that's kind of in the middle. And that's where most Americans are. But instead, at every opportunity, they've gone and talked to their most extreme elements and put together more extreme legislation. So almost nothing that has come out of the House has ended up passing the Senate. And that's where we are again.
What does that feel like? I mean, like, what is it like working in an environment where you're going to work every day knowing that the people who are supposed to be on the same team as you, as in the team for America, are actually actively trying to fight it? And I ask this, within the context of like being a creator and being an advocate myself. I sometimes feel like I'm either preaching to the choir or speaking to people who would rather I like fell off the bridge, frankly, for having my opinions. And I imagine that and when and take that into Congress and it's just like so severely heightened. So how do you sort of reckon with that every day?
Yeah. I mean, it's obviously really frustrating. I think most people don't go to Congress to do nothing or see, the reverse of progress, but that's certainly where we're in now. Even as polarized as things have been the last few years, we were able to pass things. So, the American Rescue Plan had great things in it, and people voted for that. The bipartisan Safer Communities Act that got us some headway with gun safety for the first time. Infrastructure, the CHIPS and Science Act had a few Republicans at least who were willing to cross the aisle and get things done that were demonstrably good for America. And now we just don't see that with the resurgence of Trump. They are afraid to break ranks with him, and it's so strange because you have folks like Chip Roy and some others who have really, really strong opinions about things, and they have for years said, this is my line in the sand. And now we see that wasn't really a line in the sand, or someone is a wave. I'm not quite sure what that analogy is, but they just cave. So it's very frustrating, and the way out is public pressure. So I mean, they have to be more concerned about what their constituents think than what the guy in the White House thinks. And so we're trying to give them every opportunity to come to the table and do what their constituents want. And if they won't do that, then it seems likely that their constituents will replace some of them and we can get back to work.
Yeah, here's hoping anyway.
Yeah.
Because speaking of constituents, I keep thinking about, every day we get further into this government shutdown, and I'm thinking about the fact that the people who are forcing the shutdown, the Republicans, their own constituents are actually the ones that are going to suffer the most at the with the loss of healthcare and the ACA.
Mhm.
In
Mhm.
fact, actually, just this morning I was reading an analysis that was saying that was looking at multiple large groups within the US population. And they said that if the ACA does in fact lapse, the people that will be affected at the highest majority are folks who are registered as Republican voters. And
Mhm.
so, you know, I'm wondering if you can tell me a little bit more about, like behind the curtain look at why you think your Republican colleagues are sort of holding fast on this when it's directly punishing the people that they represent.
Well, some of it is information flow, I think. And we actually have an unexpected but very high profile example of that with Marjorie Taylor Greene. So she came out a couple weeks ago and said, whoa, 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 whoa. Our leadership didn't tell us what this was going to do to our American citizen constituents. They told us it was only going to hurt illegal immigrants, people who are here in an undocumented status. First of all, that wasn't true. But second of all, they completely glossed over this idea that it was going to impact, as you said, more folks in Republican-led states than in Democratic-led states. So I think some of it was just not doing the homework and not realizing or being so all in. There's still a significant part of the Republican caucus, the Freedom Caucus, or whatever in the House, who want to repeal the ACA entirely. So they just want nothing to do with it. And even now, as they're hearing some about how this is going to impact their constituents, they're saying, well, it never worked in the first place. Well, because you've been involved in this space for a while, and I think a lot of your listeners know that the ACA has been damaged, that the Republicans have not been able to repeal and replace it. They've never had an idea on how to replace it, but they have had the knives out, and they've done some things like changing the tax implications and such that have made ACA plans more expensive. So it's kind of, what is the old story about the person who kills their parents and then cries out that they're an orphan? I mean, they've really damaged this thing over time. So it's not working as well as it should have, and hasn't put us on a path to doing better.
Yeah.
But the fact of the matter is, we are where we are now. And even Marjorie Taylor Greene's adult children have to deal with the fallout and the fact that their premiums are going to double. So I do think a lot of it is not, just following the party line and not questioning what's really going on.
Yeah, and you're absolutely right in that this isn't a new battle. This is just, I think, more at the forefront for the average American now than it was previously, right? But even if we look at something as basic as how the Republicans rebranded the Affordable Care Act to be Obamacare, right?
Mm-hmm.
And distinctly remember the week that I learned that Americans don't understand the difference between
Right.
those two, as in that there is no difference. Because there were people online who were saying things like, I hate Obamacare and I love the ACA. And I was like, oh, I've got news for you. But you're absolutely right in that they have been systematically degrading the efficacy of the Affordable Care Act through multiple mechanisms, right?
Mm-hmm.
This is their latest and arguably most significant assault
Mm-hmm.
um, in modern times, but it is not new. And so, I'm wondering, like, when you're debating them on the floors of Congress or just even just having conversations in the halls, when they are saying, okay, I don't even know if they are explicitly saying that they want the ACA to lapse because I think it's come out that even their own constituents are not in support of that. But are you getting the sense that, they have been anti-ACA for a while. They don't seem to have an issue with the tax credits lapsing at the end of this year. They are continuing to perpetuate the blatant lie about illegal immigrants, even though we already have existing laws in place to prevent all of that, right?
Mm-hmm.
What are you seeing as them proposing as an alternative? Are they even proposing an alternative, or is it just like they're just kind of like burn it all to the ground because the head honcho is telling me to do this without thinking it through?
Well, I mean, that is what we've seen for what now, over a decade, just burn it all to the ground because we don't have an alternative plan. Of course, I mean, if you go back into the weeds on history, the fact that originally this was really Romney care, not Obamacare, makes you even a little crazier. But people who have it, when it functions like it, you talked about the fact that people don't realize that Obamacare is the ACA. I mean, we've also got this issue that in many states, like Pennsylvania, it has a slightly different name. So in Pennsylvania, it's known as Penny. So some folks are like, well, I'm not so worried about that because I've got Penny. It's like, well, guys, sorry, hate to tell you, but a lot of different states have rebranded it so people don't realize that this is what is at issue. But people, by and large, like their healthcare. I've had so many conversations with constituents over the last few weeks who are very nervous. They've started getting notices from their insurers saying your coverage is going to go up by this much. I walk my dog in the morning with a group of people who walk dogs that wrestle with each other. And this one guy was telling me that, before he was married, he would often go without insurance because he had a small business. He figured it was just on him, couldn't afford it. The ACA came in, he could afford his insurance. Now he's married, he has a couple kids. His wife went through a bout of cancer. And he said right now they have to pay their deductible. She's got like $8,500 in cancer medications to remain cancer-free a month. And until they pay that deductible off, they also have to pay the $1,500 monthly fee. So they're paying $10,000 in the first month of their policy to keep her alive.
Yeah, that's crazy.
It's just insane. But you talked about, kind of the wider implications of all this. The fact that we are in this position right now with these premiums skyrocketing because people aren't going to get their tax credit. Our Republican colleagues were only too willing to pass tax cuts this summer for their billionaire buddies. Over, I think it's $4 trillion worth of tax cuts over the next few years. They made us come back on 4th of July weekend to do that, to pass that damn bill. I mean, I didn't vote for it, but they called Congress back into session from what was supposed to be a long weekend in order to pass that darn thing. At the same time, they refused to take up these tax credits for most Americans or for, the Americans who rely on the ACA. So, you can't tell me that it's about when you get your vacation or when you can, because they're only too willing to stay home for a month right now when it's impacting, Americans across the board. Small business owners, most farmers get their insurance through the ACA. I've talked to so many small business owners who are, hearing their premiums will double, and they just don't know if they'll be able to keep their business and their health insurance.
Yeah, and I think that too many folks are not understanding that this is actually connected to the big beautiful bill, which is what you mentioned over July 4th weekend, because Republicans are putting out this narrative that, oh, it's like in order to do what Democrats are asking, it will require $1 trillion in taxpayer money. And it's like, but it's not a new $1 trillion. It's like $1 trillion that in fact you took away, and then you added an extra three on top of that to provide a $4 trillion tax cut for people who are already paying a lower rate of taxes than Americans who are proportionate at their salary level. So that's absolutely true. And I think that the challenge with that is, like being a creator and a public health professional myself, I spend a lot of time thinking about how we're communicating to the public. And I find that it is not even necessarily a matter of like folks aren't necessarily understanding something. It's that the information that people are receiving is so drastically different based on
Yes.
what media they're consuming, on what side of the political spectrum they fall on. And how have you, I'm curious if you have, suggestions or tips for how you've been communicating with your constituents across the board about these like very important things that are going to be affecting several of us.
Well, I do live in a very blue region. Okay. So it's a combination of, we've got a high percentage of colleges and that kind of thing. We've got a lot of union members, and the union members have been pretty stalwart through this administration and really getting a lot of information, good information about what's going on. So it has been really remarkable. This is the second Trump shutdown I've had to deal with. I was elected in the midst of the first one. And at that time, I mean, the federal workers were screaming, you have to get the government open because we need to get paid. We need to get back to work. And I have folks calling my office now saying, no, we need to reverse course on what's going on here because this administration has already decimated the federal workforce, terrorized us, fired so many people. We need to hold the line now. So that's just kind of a shocking change in where we're at. The other thing is, you mentioned that a lot of this connects back to the big ugly bill that passed this summer. I mean, the other piece of it that's having a huge impact is the Medicaid cuts in that bill. Um, and again, they were saying we're cutting Medicaid for folks who are undocumented immigrants. No, that's not true because they don't receive Medicaid. Um, but what it is doing is creating bureaucratic hurdles so that Americans can't get that insurance, which the insurance companies and the hospitals and the health centers are looking ahead and saying, we're going to have millions more uninsured. That impacts our budgets. And they said, we're probably going to have to cut our whole dental practice here because there's just not enough reimbursement for us. And the dollars are going to have to stretch even further. So we're not going to be able to provide dental care for folks. Well, that then sets off a whole issue. If you have poor dental health, then you can develop heart issues and plus cosmetically and everything else. So it's also interconnected, and it just is really disheartening to see this kind of slash and burn mentality when you're not thinking about the real impact on real people in our communities.
Yeah, and even, when you're speaking of impact and the connectedness, I think what's worth emphasizing is like it's not just connectedness between like one, like the Medicaid domino falling to the next
Mhm.
domino. It's that if the ACA domino falls, then even the folks not on the ACA
Oh,
are
yeah.
deeply affected by it, right? Because exactly as you're saying, clinics, hospitals are shutting down or they're not being reimbursed for services, so they're not able to offer the same level of services. Even people who have private, really good insurance, perhaps through their employers, are going to experience increased wait times, are likely actually over time going to experience increased costs because they'll be carrying the burden. So I think that one of the things I'm finding that is getting lost, especially amongst mainstream media and how they're talking about the ACA battle, is that it's not just about folks on the ACA. It's genuinely and truly about every one of the 300
Exactly.
plus million Americans that exist in this country because nothing in our society is mutually exclusive of one
Right.
another, right?
Right. Well, and that's probably one reason why we've got a little bit heightened attention in the region that I represent. The bulk of my district is Delaware County in Pennsylvania, Philadelphia suburbs. And this summer, our major hospital group declared bankruptcy. Now, it was partly because Medicaid reimbursement rates are so low. It's partly because of a problem we have across the country with private equity buying up
Yeah,
hospitals.
true. We could do a whole other
I
episode
know.
just on
That's
that.
that's
Yeah.
another episode. But so we saw 4 hospitals close in this county over the last 3 years or so.
Wow.
And so that means we now have a maternal desert. We've got, just an emergency room desert. We've got a problem with having to rebuild the ambulance system so that people can get to an emergency room when they need it. And we're seeing the impact of what happens when you lose a critical piece of the healthcare system. So I think people are very attuned to it. And it opens up a lot of questions. We talked earlier about, is there an alternative to the Affordable Care Act? Certainly, we're not hearing it from our Republican colleagues, but whether or not we're going to have a resurgence in interest in other regions, I think is something that's going to be increasingly on the table.
You mentioned the maternal departments, and
Yes.
yeah, I'm a reproductive health professional, and that's the core of what I do online. And I've been seeing over and over and over again that in states where hospitals have already started to close, the first departments to go are always the maternal and
Mhm.
child departments, whether
Yes.
it's OBGYN or like the full repro division. And, it also brings up the point that the United States has the highest maternal mortality in the entire developed world, and we are now about to make it so much worse.
Yeah.
And actually, for folks who listen to me often, they've heard me say this, but if you stratify that number by race, it's even worse. Like we are some of our states, like Georgia, I believe, which is the has the highest maternal mortality in the country, is equivalent to some war-torn East African countries, and that should be a point of national shame, in my
Yes.
opinion. But instead of it being that way, we are actually heightening it and making it so that folks who are already marginalized within our communities are about to experience it even worse, right? And I was reflecting on how you said that the Republicans have gone on vacation, and yet somehow the one thing they are managing to work on during this time is coming together at the Senate level to try and ban mifepristone, right? Because they have written a letter to the FDA asking them to suspend the approval of mifepristone, even though it's been deemed safe and effective for decades now at a global
Mhm.
level. And
Mhm.
so, are the Democrats in the House, are your colleagues sort of working together to sort of help your Republican colleagues understand how they are really perpetuating like the racial and systemic inequities that already exist?
We haven't been able to get a lot of interest in that. I mean, it's one of the areas where the pro-choice caucus was very bipartisan back in the day. It has not been the entire time I've been in Congress. With some of my colleagues, Becca Balint and others, we did introduce a bill to overturn the Comstock Act, which is the Victorian era law that is still on the books that this administration, some of their more extreme members, the folks who wrote Project 2025, they want to use the Comstock Act to prevent the mailing of mifepristone and other drugs. I mean, we got to get that off the books. So Tina Smith has it over in the Senate and we have it on the House side, but it's just such a departure. This is one of the areas that is the most disheartening right now because under the last administration, with some of the expansion we've been able to do, we were able to get maternal health coverage to extend to a full year in states that hadn't had it before. I mean, there are concrete reasons why we have this terrible maternal mortality figure. It's not that other countries have come up with magical reasons. They provide good care. And
Yeah, it's pretty straightforward, actually.
it is very straightforward. And the University of Pennsylvania in this region has done great work to study it. My district is 26% African American, and we have 11% foreign born. So we have a significant population of folks who are most affected by this.
Hmm.
So in the past few years, we've been able to work with earmarks and other grant funding to bring doulas to one of the counties to help fund a birthing center in one of the other counties to try to bring some of the things that reduce maternal mortality. But now with this kind of about face at the national level and the restrictions that are coming on care, we're struggling. And with this closure of hospitals in our region, I've asked, what kind of impacts are we seeing? And they're saying that where we'd started to see some reduction in maternal health problems, we're starting to see it climb again. We're seeing, a 13-year-old being put on a wait list to get prenatal care, someone who is in their third trimester and hasn't had prenatal care, being unable to find access to it. Apparently, births taking place in ambulances are way up because people just aren't connected to the system that they need to. So this is a huge issue. It's a huge equity issue, and it's something absolutely we should be focused on. But our colleagues across the aisle are not interested in equity. They are not interested, seemingly, in maternal and baby outcomes post-conception. So we're really, really struggling here. And it's just so insane because, of course, the vast majority of Americans think we should be doing better and do support access to safe legal abortion. So this is an area where there's a lot to be done. We know what we have to do, but we need some willing partners.
Yeah, you're absolutely right. I think it's at last survey, I think it was 73% of Americans are pro-choice. And if you
Mhm.
actually if you actually add in like certain circumstances, that number jumps to
Oh,
somewhere in
yeah.
the 80s. But this is what I think is interesting, right? Is that I think Republicans have realized that. They didn't realize that in the lead up to the election, so which is why they kept talking about a national abortion ban and things like that. But now they're like, oh, when abortion is the topic or abortion's on the ballot, we are losing because people are starting
Hmm.
to see us as like the people who only care about, this made up term of unborn children within the womb. And once the actual child is alive and existing on the planet, then we just bail. But what I find is that instead of actually backing off the whole issue, they've just stopped using the words national abortion ban. And now they're going about it through these like secretive ways of like attacking mifepristone because the average person likely doesn't know what the word mifepristone means, until you
Right,
say, oh, it's the abortion pill or the miscarriage management pill.
right.
But it really kind of seems like they are simultaneously they're attacking healthcare on multiple fronts. They're coming after the ACA, they're coming after Medicaid and Medicare, they're coming after reproductive health access. They're criminalizing miscarriage in several states. They're getting rid of maternal wards. And, so it makes me think about how the future of women in America is looking a little bleak unless we're able to really fix some of this problems.
Well, we do have a White House that has really embraced some folks who seem deeply misogynistic. I mean, the number of cabinet members and other high-ranking officials who have domestic violence backgrounds, who don't seem to understand basic biology. It's really crazy, and just the dearth of women in positions of authority across this administration is really uh, not good for America.
But then there's women like you. So
I'm not in this administration, but no,
that's fair. What I mean is like fighting back actively
yeah.
in Congress. And then we've actually just recently launched a series called Wonder Women, where every Wednesday we feature a woman yeah, exactly, who's making a difference for her
Yeah.
community and society. And I think it's a nice reminder that, women, at a time where it seems like women are the least powerful we've ever been, we're also reclaiming our power in big ways.
I think
Um,
that's right. I mean, you see who's actually getting shit done, as we say, in our communities. I was talking with a woman today who was just kind of beside herself about everything that's going on. But in passing, she says, oh, but I've basically started a system to get my wealthy neighbors to help me fund food banks in our region. So she's, out there hawking her neighbors and she's getting these huge deliveries of things. She said, don't tell my husband, but I think I have a pallet of diapers coming, tomorrow. So, I mean, there are things that people can do.
yeah.
And I've been talking, there was a speech, I think it was actually a West Point speech a few years ago, but it was about doing the work in front of you. And we can't do everything, but all of us can do something. And just, picking what it is where you think you can make a difference, whether it's doing the 5 calls or helping to organize a neighborhood or registering some new voters or supporting a candidate or organizing a food bank or, whatever it is. There's a lot of work to be done and everybody can find something. Unfortunately, there's so much work to be done. Everybody can find something.
Yeah,
But
there's a role for everybody to play. And I
yeah,
think actually, Congresswoman, that's a super helpful no for people because I think they're looking for like, the real tangible ways to get involved. So thank
yeah.
you so much for your time today and for
Thank
your
you.
continued fight for all of us in Congress. And we'll stay tuned on all of your work and help amplify it. And we appreciate you taking the time to speak with us today.
Well, thank you for hosting and especially for your interest in the women's reproductive rights arena because it's so important and we need to keep fighting.
Thanks for tuning in to this episode of Women in America. If you enjoyed it, share it with your network and follow us on social media at women_in America. See you next week.